Hey everyone, today I would like to discuss a topic that is not widely discussed in the context of lifestyle changes to prevent or reduce or reverse chronic diseases, and that is type 1 diabetes. There's a lot of discussion about type 2 diabetes that is actually very controllable with lifestyle factors. It's preventable with lifestyle factors, but not so much for diabetes type 1. There are huge differences between the two, although what they have in common is the inability to process the sugars that we eat. So what is the difference? In type 1 diabetes, the ability to produce insulin, that is the necessary hormone to process the sugars that we eat, that is not produced anymore because the beta cells in the pancreas that are the only ones that can produce that insulin, they have been attacked and destroyed. So there's no means to create this insulin. In type 2 diabetes, we are able to create insulin. We are able to create excesses of insulin. However, there is a certain resistance to use it. And because we cannot use it, also the glucose is not processed in a proper way. So in both cases, we have to use external insulin. Luckily, that is available. So we still can get our glucose levels in our blood to normal levels. Usually, it's quite controllable and it gets better every year. So that is really the good news. Now, why do I want to talk about diabetes type 1? Well, although it is not so much a topic of reversing chronic disease, because we can only reverse chronic disease to an extent of non-permanent damage. And there are certain types of chronic disease that create permanent damage. And of course, that it's not so easy to reverse. And that is the case, for example, with type 1 diabetes, when those beta cells are destroyed and they are the only source to create insulin. There is not a lot we can do to reverse that, right? The thing is that when people have type 1 diabetes, they are also more prone to get other chronic diseases, like people with type 2 diabetes. Hardly diabetes comes alone. So there's a higher risk on cardiovascular diseases, chronic kidney disease. A lot of those chronic diseases that what we call comorbidity, that come with more than one. Now, there's a big insight about type 1 diabetes over the past years. What was formerly thought is that those beta cells in the pancreas, when type 1 diabetes occurs, are destroyed because the body is attacking those beta cells itself. And then, well, they are destroyed. That is the classic thought with diabetes 1. Now, what is recently found and published in a very prestigious paper, Nature Medicine, is that actually it is an epigenetic effect, meaning that the insulin that is produced, it is a protein. But because of the environment, the inflammatory environment, insulin is no longer produced. but there's another protein that is produced under the influence of the environment. So it's an epigenetic phenomenon. And it's an epigenetic phenomenon under the influence of stress, of mental stress and physical stress. Physical stress meaning creating an inflammatory environment because of foods, because of antibiotics that are destroying the microbiome. There is a certain type of stress that is impacting the environment towards an inflammatory environment, and that is making that those beta cells are producing a different hormone or a different protein. Now, why does that matter? I mean, it's a given that when you have diabetes 1, it's diabetes 1. Well, it is important because then there is a basic level of low-grade inflammation present. And that means that other chronic diseases can also come forth in the future, especially because there are a lot of children between the age of 7 to 15 that get the diagnosis of diabetes 1. They are not born with it. Nobody is born with diabetes 1. We get it in early childhood or later in life, but usually in early childhood. When we know this, we can make sure that we adapt the lifestyle as much as we can to an anti-inflammatory lifestyle, meaning stress reduction, meaning anti-inflammatory foods and drinks, meaning having enough exercise, but not too much that it becomes inflammatory. There is such a thing as too much exercise. It can create inflammation in the body, but most exercise is anti-inflammatory. So get enough movement in our life. And that are the things that we can control. Those factors are modifiable. Maybe the beta cells at this point are no longer modifiable. That's a given. But the incidence on top of diabetes 1, of chronic kidney disease, of cardiovascular diseases, obesity, overweight, hypertension, all the area of metabolic syndrome diseases, we can reduce that to a great extent with lifestyle. And I think that is really important to know, because this is a new insight that the diabetes 1 in the first place needed some level of low-grade inflammation. And when that is present, other chronic diseases may get a chance as well. So everything that is modifiable to a certain extent, our stress levels or our equanimity levels, that we have resilience, that we have a balanced mind, the foods that we take in, the drinks that we take in, that they are not sugary, are plant-based, whole foods diet is absolutely anti-inflammatory, and get enough exercise in. That will do a great deal for people with diabetes 1 and diabetes 2. But for this one, I really wanted to make sure that people with diabetes 1, or when you know somebody with diabetes 1, that it is really worthwhile to know, really impactful to know that there's a lot that we can do ourselves to prevent other chronic diseases from happening, because people with diabetes 1 are, well, at a high risk for those chronic diseases. So that was it for today. I hope this was valuable to you, and see you next time.